How I heard about the CCAC was through the emergency room visit that I had to have in 2011. At the time, I was being treated for a wound that was not healing properly. At the same time, my illness was progressing. I was getting more stiff. I got checked up by an emergency room doctor, and he said it's not healing. And he said, I will get a nurse to come to your house and to dress the wound every day for 7 days. And I said, okay, is it going to cost me, right? And he said no. And he told me what it was, like home care. So I went home, and the next day, sure enough, there was a nurse that had come in. She gowned up. We all didn't know what I had at the time, and proceeded to help me. It's a myositis, a rare autoimmune neuromuscular or muscular disorder. It leaves me always inflamed or weakened, muscle atrophy, pain, and I'm on, I count 7 or 8 medications. I have had several emergency room visits within that year, and that's when I met up, I was introduced to a case manager, a hospital case manager, and it's a really good idea. I found them very professional and prompt, and they set up they ask the questions, and they set up what needs to happen at home. And then once I got home, it was a transfer to the community case manager at Whitby. Then all these services were given to me. I was quite floored that such was available, and that I was very grateful at the time, because she was compassionate, I thought, that case manager. Of course, nursing was the first one, and then personal support worker. Then I had the medication, all the medication that would arrive couriered through for whatever the nurses need. And then I had occupational therapy, physiotherapy. Part of this illness is dysphagia, an inability to swallow. The muscles just are not working, are weakened, so they're not working well. So speech language, to look at how I could eat, swallow effectively, even though, and how to chew, really, to eat. And then a dietitian, there is a need for high protein diet. I was told that it was impossible to have coordinated. I don't know, it was one of the PSWs or the case manager, because I thought that's kind of ridiculous. I was always on the phone barking at somebody, but I can't, I can't get the nurse to come if I'm not washed. It's what's so difficult about understanding that series of events. And remember, I have no experience, my parents have no experience, some of my friends have no experience about how to work with CCAC. And the message I got was, don't make waves or say the right things, otherwise you'll lose service or they'll cut down. And this was the period of time from 2011 to maybe not so much to 2012, where I had 4 case managers, and I've only been ill 3 years. I think people need to understand the vulnerability that a patient feels, and being now on this side, I feel quite vulnerable physically and emotionally. And one of the things that I learned really quickly is to develop rapport really quick. Put on a smile, say how do you do, how's your family, and get to know them a little bit on that level. And it's probably a survival instinct. Now I have a really great rapport with my current case manager in the sense that I know to call to ask for resources or for help. For example, when I was first, in 2011, my first year of sickness, I needed care also in the evening. And I currently get 1 hour a day for 7 days. But there was a point where I needed it in the evening as well, because I physically could not even sit up properly, to change, even to heat up something to eat. And I was told that there was no money available. That's how I hear it, okay? Initially, they were so helpful because we're all riding the same roller coaster of what's happening with me. And it was also, I think, to my merit that I ask for help, which is very hard to do. Setting myself up as somebody who's self-reliant, autonomous, independent, to ask for help. But then I had to reframe it like, I'm problem solving here. Let's see who's available. And if they refuse, I just move on to the next person and see if they will have help. The self-management program, for example, I didn't know about that until my fourth or my current case manager. And I had said in the first session, why wasn't this something I knew about? Because it would have helped me. Part of it, I think, is that if in my maybe 3 years ago when I was first ill, I probably would have just had to deal with a lot of medical stuff, trying to take care of my body as opposed to my mind. Now that I'm like, okay, what's out there, and I'm at that stage, then it's what can I do now to help myself? The design of the program, ask participants to brainstorm and also do problem solving. So I thought this is solid. It engages you, it engages the participant, and it also looks at really relevant issues or topics that we deal with, like how to eat healthy, how to deal with pain. A typical day would be waking up about half an hour to 45 minutes before before my personal support worker comes, and most of the time they come at 7 or 8 o'clock, so quite early. Then after that, after an hour of that, I just relax in front of the TV. If I'm really in pain and I cannot, it was really difficult to walk down and get up, I would stay in bed. I'm also tied to services and programs offered by Community Care Durham, and they've been really great around that. So I get one of the programs is telephone reassurance, so I wait for my 9 o'clock call. And then most of my medical appointments I've learned to put in the afternoon or to go grocery shopping. Then in the evening I just relax and watch the television show. I must start first to say that I really am appreciative, and it moves me to tears too, for all the support, whether it's from the home health care system, from the various service providers there, from my family, my friends. I've been so grateful for the support that's been given me. It's been really good, but it's really been some damn hard and scary. I think one of them would have been to know what was available with the case manager. I mean, more frequent, like you can call me whenever, as opposed to I originally only expected them to come at their annual visits, and even then that was postponed. It would be helpful if it was a care coordinator to meet with a patient and to come together and have an understanding of roles. What do you do as a care coordinator? What am I expected to do? And responsibilities, what can you provide for me? And vice versa, what is my responsibility as a patient? As well as expectations, programs, and services. I think consistency would have been one of them. And it's not about, being a control freak. It's about managing what I can manage, because the medical condition itself, the disease, I have no control over it. It controls me. It's the disease that keeps on giving. Anybody who's ill. So consistency would have been good in terms of not so many case managers and their availability. Sometimes they didn't really know, and I didn't know what to ask. And that's why I feel more comfortable with my current care coordinator, case manager, to work with her, that she may not have the answers, but she's sure going to find out for me.